Hi, I'm Lauren.
I'm Cassie, and for this assignment, we interviewed Dr. Karen Clancy. We asked her to list the 3 regulatory issues she deals with on a daily basis and sort of describe those for us. Dr. Clancy has a background that includes 27 years as a healthcare administrator, providing leadership through roles such as Assistant Dean for Finance and Administration in the College of Pharmacy, Associate Director of University Health Services, Administrator of the Lucille Parker Markey Cancer Center, and Director of Cardinal Hill Rehabilitation Hospital's Consulting and Center of Learning. Most recently, she served as the Customer Relations Patient Experience Manager for the Office of Patient Experience at UK Healthcare. Dr. Clancy has several years of teaching at the University of Kentucky, EKU, and Midway University. One of the first regulatory issues that Dr. Clancy described that she deals with on a daily basis is patient rights. Patients are always informed of their rights as soon as they're admitted into the hospital, and they're also given copies of these rights. Patients are always able to file a complaint or a grievance. An example of a complaint would be if a patient ever feels as if their providers are being rude or if they are not being listened to. An example of a grievance would be if these patients have ever felt like their rights are being violated. Dr. Clancy stated that her biggest challenge is to educate providers and staff about patient rights in order to avoid these complaints and grievances. If these complaints or grievances are ever filed, it is her job to restore patient trust.
The next issue that Dr. Clancy deals with is HIPAA rights. I think a lot of healthcare administrators deal with HIPAA laws, and just people in healthcare in general all know about HIPAA. It's a major issue, and it's just because patients do have a right to privacy, so we have to make sure that we're protecting their information and making sure that it's secure. A lot of times, there's many different ways that HIPAA can be violated, and there are fines for these violations, so it's a huge issue that we have to try to contain in healthcare. She mentioned some examples of this are when providers are discussing medical information. Maybe they're in an elevator of a patient and they say the patient's name. Well, then everyone in the elevator knows who that patient is and what they're dealing with and their medical history and things like that. So we have to make sure that that's kept to a minimum. Another example of a way that HIPAA can be violated is nurses' stations. Sometimes there's moving nurses' stations that are open for everyone to see, and if a provider or a nurse forgets to log out of the computer, then we have access to that patient's medical records and you're not the patient. So that's a way that can be violated as well. Another way that HIPAA can be violated is, since electronic health records are so big now, HIPAA can be violated that way because if your network isn't secure, then there can be a breach, and then all of the patient's medical records are in the hands of someone they shouldn't be. The last regulatory issue Dr. Clancy mentioned was value-based purchasing, or the Affordable Care Act. After patients are discharged, they are given a survey which determines the hospital's reimbursement from Medicare. These initiatives impact everyone from top down, so education on patient-centered care is vital to improve survey scores. In addition, there are teams focused on very specific quality indicators. For example, some focus on readmission rates, others focus on patient falls and infection rates. So it's important that we're not discharging patients too early or too late and increasing price, like if you discharge them too late, in order to keep costs down. But we also want to make sure we're not discharging them too early because then they might get sick again or they might have to be readmitted. So we want to keep those rates down in order to have better scores for Medicare. Laws, regulation, and guidelines involving patient rights, HIPAA, and value-based purchasing are designed to ensure that patients and their families have a safe and effective experience in healthcare facilities. The challenge is to ensure that providers and staff are trained in enforcing them. Beyond the law, it's just the right thing to do. So that's one of the things that she mentioned over and over again is just doing the right thing. So in her position, she has to make sure that everyone's on their A game and they're giving the best quality of care and that they're doing what's right. So she does a lot, I guess, with ethical decisions and things like that. And that's basically all she had to say. We really enjoyed talking to her. She had a lot of interesting things to tell us about healthcare. So that's about it.